And if you're considering gastric bypass surgery, there's a new reason to have the procedure done. News 4's medical expert Dr. Peter Ostro tells us the benefits the surgery has for diabetics.
Hi, Lisa.
Hi.
Lisa Lucente had gastric bypass surgery about 7 months ago. She's lost weight steadily since then, and she's also had significant improvement in her diabetes. That had been a serious problem.
It got to the point where we couldn't control the morning sugars, so we went to the highest dose on both of my oral medications, and they put me also on an injectable twice a day and said, Lisa, our next step is going to be insulin.
Weight loss has always helped type 2 diabetes, but there's more to it. 2 new reports in this week's New England Journal of Medicine compared weight loss surgery to conventional medical treatment in obese diabetics. And in both studies, surgery induced remission of diabetes better than medical therapy. Lisa has experienced that.
You've been on 1,000 milligrams of metformin. Why don't we reduce that to 500? You're going to take that at night.
Okay.
And I would expect probably within the next month or so, you might not need that altogether.
Dr. Caruana has done weight loss surgery on about 4,000 patients, and he's noticed this frequently.
Even within days, 2 or 3 days after gastric bypass, when it was time to send a patient home, they were going home with a lot less medication than they came in with.
He and his colleagues studied some of their patients and may have found an explanation.
Patients before surgery had circulating blood levels of toxins in their system, probably from their own gastrointestinal tract, which were greatly reduced by gastric bypass.
Lisa is losing weight, her blood pressure and cholesterol are down to normal, and her diabetes is under control.
Now I wish I would have done it 10 years ago, but I did it now, and like I said, I had to be ready, and I was ready, and I did it, and I'm just thrilled.
Now, what this probably means is that weight loss surgery should no longer be seen as a last resort, particularly in people who have poorly controlled diabetes. With this new information about the benefits, surgery is an option that more and more primary care physicians ought to be discussing with their diabetic patients.
Well, great news for those patients. All right, thanks.